All right, now we're on to lungs and their pleural coverings. That's an interesting title, but basically these are things on the outside of the lung. The last video, the one preceding this, was a lot about the tubes, a lot about the internal structure. This is basically the external structure. And so in order to see those, we're going to look at a couple different images. We've got a couple from your lab book here that are cartoons, and then the models are great for these ones too because these are external, easy to see structures. So the first one is the apex. The apex is there's a left and a right apex. So right and left apex of the lung. It's just the superior region of the lung, the highest point. The base is the bottom of the lung. So the right base and the left base are basically connecting indirectly to the diaphragm. This is our respiratory muscle. And so the base is very broad, and you can see it right through here. So on this image, the apex would be here and here, and the base would be the very most inferior region of both of the lungs on the bottom. And then our next topics are these little fissures. So we have cracks. The lungs themselves are broken up a couple different ways. The most broad way they're broken up first is the right lung versus the left lung. But going in more detail than that, the right lung has three very broad subdivisions, which are called lobes, and the terms are right down here. So on the right lung, you have a superior, a middle, and you can just barely see it in this image, an inferior lobe as well. So if we go up here, superior, middle, and inferior. Again, just remember the right lung has three lobes, and they're just named based on their anatomic position. The left lung is even more simple in that it just has two lobes, a superior and an inferior lobe. So try to remember that. Right lobe has three lobes. Sorry, right lung has three lobes, left lung has two lobes. One reason that the left lung has only two lobes is that it has a whole space carved out of it for the heart. Because the heart is sitting in here. You can see it better on the model. So the heart is sitting, occupying a lot of space that is subtracted from the volume of the left lung. So if we come up here, we have a couple fissures. We have three fissures, but we have some common naming for them. Let's go back up to this one because I think it's a little easier to see. So both lungs have an oblique fissure. Oblique meaning cutting an angle that's not horizontal and not vertical. It's kind of an awkward angle. So there is the right oblique fissure. Here's the left oblique fissure. So that 45-degree angle, that should translate into the word oblique in your mind. So both lungs, both the right and the left lung, have an oblique fissure. Then there's only one horizontal fissure. And the horizontal fissure is just on the right-hand side, and it's between the superior and middle lobe. So horizontal fissure, oblique fissure. This one always screwed with me a little bit. I feel like when I took this class, I had a hard time remembering those things. So just remember the only fissure, the most superior fissure when you're looking at these in the anatomical position is the horizontal fissure. It'll be above those other ones. So here it's the most superior one here, and then there's two more here and here. So these are your oblique fissures, oblique fissure. Horizontal fissure is always highest up. That is especially helpful when looking at a cross-section of the lungs. Notice that it's a little harder to see here, but this middle lobe of the lung is sort of like a wedge shape. So the right oblique fissure actually cuts up more than the horizontal fissure, and they actually come really close together in the back of the lungs. So when you're looking at the back perspective or the posterior view of the lungs, the middle lobe appears to be much smaller. And you can see that here. That's the middle lobe of the right lung. That's the horizontal fissure, and that is the right oblique fissure. All right, a couple other surfaces here that we need to talk about. One is in general the costal surface. Costal means ribs. So the costal surface is just the sort of the most external surfaces of the lungs that are all completely surrounded by ribs. So you have an anterior costal surface in this image. The lateral costal surface would just be the lateral surface, and then you can't see it, but on the back side of the lung or the posterior side would be the posterior costal surface. Then you also have a general term called the medial surface of the lungs, and those are the ones that are a little harder to see because they are internal. You have, so these are the surfaces that are not touching ribs. That's what that medial surface is. Instead, it's the surface of the lung that's pushed up against the major blood vessels and the heart. So on the left lung, you have a cardiac notch, which is really just this little bite taken out of this external view. The cardiac impression would be if I pulled this lung off, there would be an imprint from the left side of the heart on the inside of this lobe of the lung. You literally have to pull the lung off and look at it, and there would be like a heart print, kind of like putting a handprint in something. It'd be like a heart print on the internal surface of the lung. You can see a portion of it right here. The heart made this indentation, so that's called the cardiac impression. So the cardiac notch, again, you're going to have a completely assembled lung to see it, and it's just this ridge. You could draw a line right here, whereas the cardiac impression, our best view of it is right here. And then you've got the hilum or the hilum. That's a little difficult one to see, so I'm going to use our Essential Anatomy app to take a look at that one. So highlighted here is the entire left lung. If we can squeeze in here, what we'll see, here's your left primary bronchus here, and it goes into a region of the lung called the hilum. So what is in green right there is the hilum or the hilum. You can say it however you want. And what this is that all this other tissue, if I click here, this is a bunch of alveoli and alveolar sacs like we talked about in the last video. If you zoom in on the histology of that structure right there, it's not a bunch of alveoli. It's actually connective tissue, so it's much more dense. What it's doing is creating sort of openings for major blood vessels and your primary bronchi to enter and exit the lung. And so that's what this structure is. This is not, so if you had like an infection in this area, it wouldn't be a good thing, but it wouldn't actually decrease your respiratory ability directly because it's not collapsing alveoli. And so this is your best kind of visual representation of the hilum. I think the software does a better job of this. So on a quiz, I might just screen capture this exact picture, remove the labeling, and ask you about it. But then here you can take that better image and sort of apply it to our models. In general, this area would be the hilum right here, but it doesn't do quite as nice a job illustrating that. So I will most likely either describe it to you in words, as, for example, the region of the internal structure of the lung that allows for the passage of the large blood vessels as well as the primary bronchi. The answer to that would be the hilum, or I'll show it to you with a screen capture of the software. All right, and then our last couple topics here are one is called the bronchopulmonary segments. That's a little bit of advanced pulmonary anatomy, but basically there are, in most people, about 10 subdivisions of the lung. So if you go back to this picture, each one of the tertiary bronchi connect to their own isolated region of the lung. And so every tertiary bronchi leads to a single, what's called bronchopulmonary segment. And your lung, if you look at this, it really is like a tree. And each one, let me just show you a picture of it. I think it's a little bit easier to see. Some picture kind of like this. Ooh, it's a little blurry, but so here's what it's showing you: trachea, primary bronchi, secondary bronchi, tertiary bronchi, and then those all lead, and these are all color coded, they lead to different regions of the lung. So if you look at the lower part of this picture, these color coded areas, those aren't lobes of the lung. They're actually more functional compartments of the lung, meaning that each colored region sort of acts as its own little miniature lung. And the reason that that's sort of important is that though you can break down the lung into different lobes, those aren't functional. They're simply anatomical. So when it comes to like pathology of the lungs, what would be important to know, for example, if someone has swelling in their lungs, you would want to know how many bronchopulmonary segments are affected. Because if 9 out of 10 of them are affected, that lung is essentially not going to work. But if only 1 out of 10 of them is affected, then it'll work just fine. And sometimes they'll go in and cut out chronically infected regions of the lung. And the way that they do that is they go in and prune it like a tree. They go into one, or let's say the yellow or the pink bronchopulmonary segments are filled with fluid. They've been like that for years. They're prone to infection. So let's just remove them and get them out of there. Well, what you do is you would go into up here, yellow and pink, and snip out the yellow and pink, and those yellow and pink regions or bronchopulmonary segments would lift right out. So it's actually really convenient because you can sort of prune the lung like you would prune a tree, and everything else gets left intact because each one of these bronchopulmonary segments are their own functional units. So that's kind of cool. As far as me asking you about this, here's what I want you to know. I want you to know that each tertiary bronchus leads to a bronchopulmonary segment. That's what I want you to know. I want you to know it what I would say conceptually rather than visually. Your textbook doesn't have these broken out in colors, so I'm not going to ask you visually. So I'm going to ask you definitionally or conceptually. Again, the tertiary bronchi lead to the bronchopulmonary segments. That's what I would like you to know. Do I want you to know that there are 10 per lung? No, I don't think I do. But you should probably remember that in general, but not for this class. I won't ask you the numbers. All right. I foolishly resized it there, so let me get a little bit reoriented here for our last couple terms. So our last topic is really the fact that the lungs themselves are in tissue layers called pleura. And specifically, there's multiple tissue layers, and we've seen this with the heart already. We're going to see it with the kidney a little bit. But basically, you need lubrication. Remember, the pericardium of the heart was a layer of tissue. One layer was stuck to the heart, and the other layer was not. And between those two layers, there was a lubricating fluid. That's the same idea here with the lungs. There is a layer of tissue that's very thin and very smooth that is connected to the deep layers of the lung. It's literally sucked onto the lungs like spandex. That's called the visceral pleura. Visceral means deep, so that's the deeper layer. So try to remember that. The parietal pleura is the layer that's actually not stuck onto the lung. The parietal pleura is stuck to the rib cage. And so it's actually anchored onto the rib cage. Between those two layers is what's called the pleural cavity, and that's filled with pleural fluid. And then our last structure here is the diaphragm. We've talked about this before in first term. Diaphragm is a voluntary skeletal muscle. It's very broad but very thin. When it contracts, and this is, I think, on your homework for your lecture, when it contracts, it pulls the base of the lungs down, which expands the thoracic cavity and pulls air in. So you don't have to know those functions for this week, but next week we're going to talk about the mechanics of exactly how that works. But the diaphragm for this week, just be able to point it out on a picture just like this, or on your model picture down here. That's all diaphragm right there. All right, and that's it for this video.